Functional Fascial Taping, or FFT, is an innovative treatment technique used for musculoskeletal injuries. It is a quick, effective way to increase range of movement and decrease pain. Acting as an analgesic, FFT creates an environment that allows for rehabilitation. In some instances, the tape is applied to change the tension in tissue generated by movement. The name functional fascial taping is derived from the technique of applying tape in a functional range of movement to create a load on the fascia. Ron Alexander discovered and developed FFT in 1994 during his 8 years as therapist with the Australian Ballet Company. As a therapist for 64 dancers and 30 touring staff, in a company that has the second highest number of performances per year in the world, Ron found that conventional taping in the subacute stage of an injury would not meet the needs of such high performance levels, nor the mobility required by the dancers. Let's see and hear some of the benefits achieved through the use of this technique.
And functional fascial taping is an excellent technique because it's something that's relatively quick and relatively simple to apply. You can do it on the field, you can do it in the rooms. It's got the ability to be applied to a wide variety of conditions and to different areas of the body.
Sorry, if you're there and you've got your pain, how much further can you go?
Can't go any further.
You can't go any further than that?
No.
Okay, now do it again. What's it feel like?
No pain at all.
Can you increase your range?
Yep.
Can you take your arm out?
Yeah, no pain. Just starting to at the end now, but
It's pretty good.
decreased pain.
Have you got anything through there? Not at all.
Not at all.
Anything up here?
No.
A little bit.
Yeah, that's where I get the pain, like there.
Yeah. Just give it a go and see what it does.
Yeah, I can feel that there.
In there?
Yeah.
Okay. So it's when you're landing, or is it when you're taking off?
Both.
Okay, try that again.
Yeah, that helps.
So were you doing this earlier, before, and it was hurting?
Yes.
Yeah. Okay. Shall I do one more?
Yes.
Yeah. Great.
Yeah.
It feels good.
Yeah.
Excellent.
Thank you.
No, thank you.
Our final follow-up of Stephanie was 10 months after our initial one-on-one consultation at the Victorian Institute of Sport. During this period, Stephanie competed in the Australian National Championships, followed by the Commonwealth Games, free of any medial tibial pain. Bob Hardy has had arthritis for the past 22 years in both knees. Bob's main problem is the pain he experiences in his left knee. On X-ray, we can see he has very little to no cartilage. We're going to replace Bob's knee X-ray with the X-ray of a normal knee to illustrate the degree of deterioration.
So if you put your foot down,
Yes.
and then you go to lift it up, stop at the point where it hurts. How does that feel, lifting your leg up and down?
There is absolutely no pain at all.
No pain at all? Fantastic.
The conditions shown in this video represent only some of the pathologies managed by FFT as an introduction to the technique. For everyone, from elite athletes to office workers, this non-invasive treatment can be greatly beneficial for use or as a valuable adjunct to the standard treatment of musculoskeletal injuries. V8 supercar driver David Bernard had a major car accident 7 years ago.
The chassis rail basically came through there, knocked a section of bone out. That's one of the breaks there, and the other one was up here a bit high, and it just knocked that section of bone out. It broke the fibula up really up high where the joint is, in two places, down a bit lower as well. The tibia in two places, and dislocated both knees and broke this kneecap and broke the tibia here, but that was a clean break and that one healed quite easily and quickly. The bone now is no problem. It's got the lump and doesn't look so pretty, but yeah, the bone I don't have a problem with. It's just the knee from the dislocation that, you know, when I train hard, it swells up. There's a bit of swelling there now, which is pretty common. Yeah, and gets a little bit sore on both knees, more so this one though.
So that was May 1995, wasn't it? Yeah, so 7 years later you're still having problems, but it's sort of more around this area.
Yeah, that's right.
Okay, wind him up and see if you can hurt him.
So that feels really good. Just starting to feel, must feel where the tape is here, it's pulling a bit,
Yep.
which is restricting it. But as far as the knee goes, I can't really feel the awkwardness.
That's a good percentage already, mate. We've already moved him here, so yeah, we removed him about 15 degrees, 20 degrees.
You can go more. And just from the way it felt when we were stretching it, it feels unbelievable. I would have bet $1,000 you couldn't make it feel that good in 5 minutes. So it's definitely done something there. And if it's
Muscles get inhibited very potently and quite reflexly from the presence of pain. So in order to rehabilitate muscles successfully and effectively, then controlling the pain is really vital. Some pain is helpful as a protective mechanism, but the protection is only necessary when the tissue is about to be damaged, and in a rehab environment you wouldn't be taking them into a position where the tissue is about to be damaged. So what you want are the benefits of the pain-free environment without the risk.
Our final follow-up of David was at 10 months post-taping. David reported that he remains pain-free in all activities.
I could never run before, like straight away almost, it'd start to hurt. But nowadays it seems to be fine. I went for a run not long after we taped it and didn't have a problem. I just haven't had a problem since.
Yeah, well, since we've been able to tape everything, I think we find the knee was so weird, we couldn't put him, he had no movement in the knee, which was causing everything else to be tight, so we couldn't actually stretch anything. So now that the knees feel good, we can put the pressure on, we can stretch the muscles that we're actually trying to stretch.
Yeah.
All the muscles that weren't really working full range of movement are, and the knee's been fine.
One of the great things about the fascial taping is because its instantaneous effect on pain is so functional that the athletes can still perform at a high level and train at a high level without pain, and therefore it provides a very viable alternative to using drugs for pain management. If you can affect the pain, then you can take a step further and alter their technique so that they're not continually overloading that structure, and this gives you the opportunity to do that, whereas otherwise it would be potentially a much slower process to do it, or maybe you can't even do it.